and welcome to the Plenty of Positivity podcast. I am your host, Courtney Beck, and today we have an incredible guest, Dr. Hisham Seify. Dr. Seify is a board-certified plastic surgeon. He is also a clinical professor of plastic surgery at UCI and the director of the OC Aesthetic Fellowship. It is my absolute pleasure and honor to welcome Dr. Seify.
Thank you so much. Thanks, Courtney, so much. Thank you for having me.
Dr. Seify, what an honor it is to have you on the podcast. You are the first plastic surgeon to be on this podcast.
I love it. That's awesome.
So exciting to have you here today. So I thought we would begin with an introduction and a background of yourself.
Sure. So again, as you said, I'm a plastic surgeon. I did my training back at Emory many years ago, and I did a fellowship as well after that. I practice in California for many years now, almost 20, and I teach at the university as well. And I'm very interested in plastic surgery in general, both nationally and internationally. So we do a lot of outreach, and I know we're going to talk a little bit about all that. And then other stuff we do and nonprofit work and sports. And so there's a lot of good stuff to talk about.
Fantastic. Thank you for that introduction. And I always love beginning, literally at the beginning. So what inspired you to go into medicine, like heading in that direction, and then specifically plastic surgery?
Well, it's a great question. So I started always by loving biology. So I always loved biology. I always loved physics. I was not good in math. So I knew from the beginning, engineering is not going to be for me. So that went into the time. And then came the time to what profession I would love to have. And I think I liked medicine a lot. So this is how I jumped into medical school. And then inside medical school, you get exposed to all specialties and things like that. And I get a great opportunity to travel to France. And it was by luck, total luck, to a plastic surgery department in France. And I saw that for the first time and I was like, oh my God, this is so cool. I need to do that. That's exactly how it happened. And here I am. So
that is fantastic. And you certainly have so many accolades and awards. So without a doubt, we will get into like the specialty part. But I would just love for you, as you reflect back, just your journey so far, what have been maybe some defining moments, specifically as a surgeon and as a leader?
It's interesting. A couple of weeks ago, I was giving a talk about something. I was getting an award about something, and then I asked me to give a talk, and I gave a talk, and the name of the talk was "The Wisdom of Closed Doors," because when you reflect back on your life and you see what happened to you over the years, you realize that pretty much all the closed doors were blessings, and every time something bad happened to you, or not even bad, just a challenge, you end up looking back and thinking, oh my God, if I did not have that challenge, I would have not achieved this. So when you face challenges, when you face adversity, know that it's a gift. Of course, the way you handle it is going to be the future, but it's always a gift in my mind.
Absolutely. It reminds me of that whole idea that it's not rejection, but it's redirection.
100%.
And I really do. I like how you mentioned just the idea of really focusing on that specific mindset, that perspective of looking at it, that it's a good thing that it did close. You can't see it at that moment, but in hindsight, looking back, you could connect the dots then. So thank you for sharing that. And you mentioned it at the very beginning, but you have certainly served internationally as a visiting professor and surgeon. So how have those experiences influenced your perspective on medicine, but then also humanity?
It's incredible. I mean, my background, I had training in different countries, and that kind of gave me a lot of connections, relationships, and so forth. So when I finished many years ago, I got invited to start giving talks and doing surgeries in different countries, and I started really liking it. So it became part of my life, and I cannot imagine living without it, to be honest with you. And even sometimes people tell me, why you travel so much? And you probably lose money when you do that. And I said, yes, I actually do, but it's not important. It's not about money. We're all going to be fine. We're going to work. Everything's going to be okay. But it's also these deep connections to what you can give to people. And by the way, when you travel, you learn as well. As much as you teach, you learn. And that's very valuable in my mind.
No, absolutely. And I could only imagine learning about different cultures, different backgrounds. It also provides, I would imagine, just that sense of like compassion, having that sense of like empathy for others. And, you know, I wanted to specifically ask you like some leadership questions, but what do you believe specifically separates like that technically skilled leader from just being a truly great leader?
Emotional intelligence, the ability to talk to everyone. You can talk to kings, presidents, and you can talk to a very normal person on the streets, and you can have a rapport. You can have a relationship. You can have something to talk about. It has to start with respect. You have to respect everyone. It doesn't matter where they come from. It doesn't matter what's their level of education. You can learn from everyone, and that's a key thing. And once you establish that, then you start communicating in a meaningful way. And when you sit with people and talk, you really mean to talk about something. When you ask them a question, how you doing, you really mean it. You're not just doing small talks. And I think people perceive that. And honestly, in my practice, I've been really focused on this. I treat my patients almost like family members, and I tell them this is what I would have done for my daughter or my son, or that's what I do, and it is what it is. And that, yeah, so just treat them with values in my mind, and then be genuine. I think that makes all the difference.
No, absolutely. And I love how you highlight emotional intelligence because that is something that I think is becoming more and more valuable within not even probably medicine, but just all industries itself with technology heavily infiltrating all industries, but the human connection, how we communicate and how we form those connections with one another, I do believe is going to be even that much more important moving forward. And something I wanted to ask you because I feel a lot of the times when we look like on, for example, like a CV or a resume, we could see all the success, but there's always that journey in between, Dr. Seify. And so I wanted to ask you, like, has there like something that maybe stands out as far as like a challenge that you were able to overcome that you would be willing to share with our listeners?
Remember, was it Winston Churchill who said success is going from failure to failure with enthusiasm, something like that? So so that's about it. I mean, I think if I look back, and I did look back because I was giving that talk about everything, I did have failure in school, and I was about to be kicked out of school, and because of that, I had to work very, very hard, and eventually I became one of the top students basically, which led me to medical school. And then in medical school I had a challenge, and that challenge made me go to plastics, and in plastics I had a challenge, and that made me build my own practice. And so it is just all these negative experiences, which in my mind are not negative experiences, they were just meant to be. You were meant to be put in that position, so you challenge yourself and you go to the next level. Otherwise you would have not done it. Yeah.
So true. And, you know, even as we speak about these challenges, and you obviously were just speaking about them, but as you reflect, like, what was, how are you able to really move forward with a positive mindset to get through those challenging times? Like, what would you remind yourself as you were going through those challenges?
I think obviously every time is different. Like, in school we don't have that maturity, we don't have the experience. You just try to challenge yourself and try to do better. I think as we get older, we understand now that these challenges are real challenges. But one of the very nice quotes I always remember, and I always put in my office actually, it says that the right doors won't open for you until you're the version of yourself who are meant to walk through them. So whatever happens to you is just something that is continuous upgrades. Think of it as like a software. So we're 2.0, 3.0, 4.0. So that's who we are every day.
That is true. You know, as I like, as literally as you were just saying that, this goes back to many years ago, but the AOL version when you would get it in the mail.
Yeah, remember that?
Right, absolutely. But I really do. I like how you mentioned that because it really is a mind shift of understanding that when we do go through those challenging times, that we're getting that much closer to the version that we need to be in, to go into maybe a specific career or to take on a certain role. So without a doubt, I love that. I also wanted to ask you in particular, so of course, leadership throughout your years can certainly evolve with certain experiences that you have along the way across your journey. And so I'm curious from when you look back in hindsight and then how far you have come to present day, have your leadership, the style or even leadership philosophy, has it changed and maybe how so if it has?
I think with experience, definitely. I mean, definitely now, first of all, you think before you speak, right? So before jumping on something and just take your time and try to reflect. When you're dealing with a group of people, um, it's not easy to understand the dynamics. And I think this is comes with experience and maturity. And this is something I developed over the years. Like I would say 20 years ago, I probably would go into meetings and feel bad about something. Or now I understand well that you go into something, you sit, you listen, and then depends on if you're the leader of that group, then you really have to direct them, but you have to convince them also that this is the best thing for us as a group, and then you kind of work on this. And then also something I learned from a friend of mine is sometimes you have to let people go from a group. And if a group is not coherent and one person is totally outside of the group continuously, it might not be the best place for them, and maybe they're not the best members for you. And that's something is not bad to say. And you always can do it in a very nice way and a very honorable way without being upset, right? It is what it is.
Absolutely. And I love how you mentioned listening to at the beginning there, because that is something that I really have been working on is more of that active listening, because I feel like today, even when we're focused on something, it's like the multitasking, like we're doing so many things at once. And so to be able to really focus on active listening is really, I feel like it's a skill in leadership that is becoming more and more valuable. So thank you for really mentioning that. And I want to kind of shift gears right now because this is incredible. So I want to understand like what specifically motivated you to co-found the Worldwide Cancer Network. How did that come about?
It's a personal story. So at that time, I finished my training, and and then my mother she had cancer, and she had an advanced cancer, and she actually passed quickly. And at that point, a friend of mine, who I co-founded with, was in the cancer business, and he said, "Warren, do you want to do this? And let's co-found something for nonprofit." And it was just the perfect timing. You know, if this my personal experience did not happen like this, maybe it was not the right time for me. But it just hit exactly the right time, and obviously the right partner as well. I believe you cannot do things by yourself alone completely. I think you have to have the right partners. And once it's the right time, the right partners, then it will be successful.
This is that absolutely incredible. And I'm curious, like, how long has this nonprofit been going for, and what does the work within it, what does that look like?
So I think the idea started 2008. We were official around 2010, and then we started operational maybe 11 or something. And we were just the US, and then we extended into Canada. And then now we are also in England, Switzerland, and Dubai recently. I was actually in Dubai last month before the war, doing a nonprofit event. And we support the cause of cancer, especially pediatric cancer, both for the treatments, for the research, for the support of the families, the people. There is an iconic hospital. It's called 57357. It's located in Cairo, and it's kind of serving the whole Middle East, Africa part. A lot of communications with U.S. universities. We have agreements with Harvard, with many other places to train people and to train physicians and to treat patients and so forth. So it's been a great international effort so far. I'm very lucky to be part of it, to be honest with you.
Absolutely incredible. And my next question goes into the fact, like I had mentioned, I mean, you have an abundance of just success, whether it's awards, those accolades, and then even to be able to kind of go into that particular area of nonprofit. So my next question kind of deals with more so of balance. How do you balance everything in life, family, work, career?
Well, the truth is, I probably don't have balance. I probably just keep working. And I think, reflecting back, I think I had the right support from my family, from my wife, from my kids. I think the community also. I mean, we're in Southern California, incredibly supportive community, lots of good friends. And then we found other supportive community in New York and New Jersey and Dallas and Houston, and then in Europe, and then in Dubai. And it just, people alike, they connect and they share ideas and they do things. So I think I was just lucky. It is a struggle to balance work. I'm a busy surgeon. I operate 3, 4 times a week. And I still obviously have the other social things to do and the family and the kids. But I think you end up finding time for what matters in my mind.
Absolutely. And this next question is more kind of pivoting back into medicine itself, but with AI, with technology coming full force, has already certainly been here for a while. But what do you see as far as like specific skills that future surgeons are going to particularly need into as we do head into the future?
So first, we all need to learn AI. So I started training myself. I'm not that good at it, but I know how to use it, and I've been using some of it. I think it's an incredible tool. You are just using a huge power to help you. You're not, in my mind, it's not substituting human beings. It's actually helping them to achieve better results. In fields of medicine, I think it's going to be incredible in helping diagnose disease, reading MRIs and CT scans, doing a lot of things, even in surgery. If I can have an assistant who can give me a million scenario in 2 minutes, well, that's great. You know what I'm saying? That's all the human knowledge that anyone can do. That's a great helper for me. Now, are we going to get to a point where a robot will treat you and do surgery on you and there will be no humans? I think we're very far from that. I think maybe in 50 years or so, but I don't think we're there at all.
No, absolutely. And I do. I think like the point that you're making too of even that connection too with a physician being able to speak about, because I was doing some research before this conversation and just some testimonials of your patients and their experience with you. I mean, I feel like that is so unique, so powerful to be able to share a story, to understand why a patient would need or desire a certain type of procedure, I think is really, really important to hold on to. I do. I feel like in medicine. And so, my next question is, kind of dealing with this is more broadly speaking, but many professionals really do. They desire to strive for that excellence. And so, my question for you is, how did you sustain excellence for such a long period of time? Like, is there maybe some tips or advice that you could provide others?
So, there's a joke in medicine, in surgery especially, that we say, what's the definition of an expert? He's the guy who done all the mistakes, right? So first of all, be humble, right? It doesn't matter how good you are. You can make mistakes. We're all human. If it happens and you make a mistake, learn from it, own it, acknowledge it, manage it, obviously, and learn something, and then try to get better as you go. And again, stay humble, stay humble, stay humble. I think the mistake in my life, the surgeons that I've seen making bigger mistakes are the one who did not learn from their first mistakes, and they also were not humble enough in my mind.
That's a very good point. And I do. I've always spoken about that on this podcast that there's nothing wrong with making a mistake, but kind of reflecting, what could you learn from it? And as you move forward, of course, not make that, same mistake again. And then the humility part, without a doubt, no matter how high you climb on the corporate ladder, within medicine, terminal degrees, but that there's always something new to learn. So remaining humble, I really like that point that you drive home there. And, I feel like with all of the recognition and all the awards, how do you personally define success today after getting all of those awards and recognitions throughout the year?
I think it's the ability to get better every day. I think it's the ability to get up in the morning and realize whatever you've done in the past is great, but it doesn't count today. You know what I'm saying? What counts today is what you're going to do today. And if you don't do something good today, then it's not going to work. I'll tell you a quick story. I was working in my residency. It was one of the top surgeons who does thyroids, right? And it's a tough surgery. And his name is Dr. Weber. And Dr. Weber was doing this and was very worried about getting the nerve. And I said, Dr. Weber, you've done more thyroids than anyone in this country. And he stopped surgery, looked at me and says, Hisham, you understand that if I hit the nerve, I'm going to stand in front of that judge and he's going to tell me that all this 40 years of experience means nothing because today you made a mistake, you hit the nerve. So it doesn't matter. So basically, it's what you do every day that matters.
No, without a doubt. And, looking into kind of just where we are present day, like within medicine, what types of innovations maybe are coming down the pipeline or that you're excited for?
I think definitely longevity. I mean, definitely this is the regenerative medicine and longevity, especially with plastic surgery. I think it's the next big thing, which is already happening. So, and we're trying to incorporate this in terms of, I don't want to say the word stem cells because it has a little bit of meaning, but anyway, but the fat cells, the exosomes, the peptides, all these incorporated it into the patient because you're not trying to just make the patient look better, but they also have to feel better and they are better health in general. So I think this is really the big things. We were just asked to write an article in one of the journals about the integration of plastic surgery and longevity and regenerative medicine. And our group is working together on it. So this is, to me, is going to be great.
That is fantastic. And I would love to know within your practice, what do you believe allows you to stand out as far as even like patient experience? What is something that you really pride yourself on for your practice?
We're very compassionate. We treat our patients exactly our family members while giving them the top-notch treatments. So um, you don't want your physician to be your friend, but in the same time, you want them to care about you like a friend. And that's what you want. Sometimes when you choose a physician, you don't choose Einstein. You don't have to choose the smartest person on earth, but I want to choose someone who's top notch, but in the same time, I can talk to, I can trust, I can work with, and he would respect me. That's, I think, what people mainly looking for.
Absolutely. I do. I like how you mentioned kind of pairing that expertise, but then going back to what you were saying at the beginning of the conversation, just that sense of emotional intelligence, being able to find that connection as far as being able to share stories in order to get that specific procedure that maybe the patient desires. So that's fantastic. And I'm just curious, Dr. Seify, like what is next for you?
You know, a few years ago, I put some challenges for myself. You know, I said, what are the challenges in my life? And then I put them as career challenges, family challenges, with our kids growing and trying
Sure.
to get them the best and so forth. And then I put health challenges because we're all, hopefully, we're getting younger, let's put it this way. So we got to take care of ourselves, right? And to me, I still put these as the challenges. You know, you got to just, and then the community. You know, whatever you do for the others, whatever. So I try every few months to go back and look at these and make sure all these boxes were checked properly. And if not, you try to readjust yourself. So that's so far. Yeah.
That is absolutely fantastic. And do you have any specific hobbies or even in the past, like any particular sports that you enjoyed playing?
So interestingly, a few years ago, you know, I started getting a little bit lazy and I gained some weight. And then I started, I got to go back and exercise. So what do I do? And then I thought, what did I like to do when I was younger, much younger? So I used to swim, I used to bike, and I used to play martial arts. So I said, I got to go back to something I like. Martial arts, I'm old for that. I don't want to break anything. So I put that on the side for now. So I went back to swimming and biking, and I've been biking quite a bit. And sometimes my daughter and son, they come with me, and swimming also whenever the weather allows it. So in my mind, do the things you like to do. It cannot be a punishment. It has to be you're happy about it, in my mind.
I reflect with exercise. What was so interesting was being after I was done with sport, finding a sense of like purpose behind exercise, other than the fact, of course, staying healthy. But that was like the difficult part. But then once I got into running, I've done a couple races. I'm by no means this like this person for endurance running. But I did my first half marathon, and I think it's to your exact point. Thank you. But it really is. It's about like training for something with purpose behind it. And I'm curious, just a little like side question. I know you listed swimming and biking, but how about the running? Like, would you ever do a triathlon?
So many years ago, I started training for half marathons like yourself, but then my knees starting to hurt. So I went to an orthopod friend of mine, and he looked at me and he said, if you continue this within 5 to 6 years, you're going to need to do your knees. So I said, okay, I got the point. So that's when I stopped the running part. But running is amazing because it's the most efficient sport, to burn calories and to get the cardio. But also the knees, you got to be careful with your knees. Yeah.
No, absolutely. And Dr. Seify, I would love to round out this podcast episode with a positive message or a positive quote for our listeners in the community.
You know what I love always, which gives me peace of mind, is a quote that says that whatever is meant for you will never miss you. And whatever missed you in the past was not meant for you and probably not good for you. So don't worry about anything. If it's meant to be, it will happen. Otherwise, it's not, you don't need it.
That's so true. What a fantastic just message to end on. And Dr. Seify, I really do. I genuinely want to thank you for coming on the podcast, making time to share your expertise and just your outlook on life, your positive outlook on life. So thank you so much, Dr. Seify.
Thank you so much. Pleasure having me. Thank you so much.